Back in the day, in a small town of Scarborough, on the eastern part of the city of Toronto, Canada, there lived an elderly woman called Emma. She lived with her son, Alan, his wife, Rose, and grandkids, David and Stella. In 2020, a deadly virus started to spread fast. It mainly attacked seniors. Rose, Emma's in-law, often got angry at her husband, Alan, pushing him to kick Emma out of the house, citing that Emma could be a carrier. One evening, as Alan returned home from work, he found Rose yelling and scolding Emma for merely not closing the washroom door. Alan was dismayed, as this is not the kind of behavior or treatment he wanted his mother to endure. He further got to learn from the kids, David and Stella, that their mother often locked Grandma in her bedroom and did not feed her for the whole day whenever their dad was on business trips. When Alan tried to speak with Rose about this, she threatened to leave and take the children with her. She further demanded that Emma be thrown out of the house. However, Alan refused to adhere to her threats, and Emma stayed. The situation worsened. Rose constantly picked on Emma, called her names. "You are good for nothing. You are useless and a burden to my family." One afternoon, Emma needed assistance to get off the floor. Rose pretended to give her a hand, but held her so tight that she left a bruise on Emma's hand. Emma did not tell anyone or show anyone the bruise on her hand. She was frightened, nervous, scared, because she had nowhere to go, even if she wanted to leave. Luckily for Emma, there was a door-to-door sensitization campaign about the prevention of elder abuse and violence against women in COVID-19, organized by the Red Cross Society Canada within the area. A young lady knocked on the door. Emma opened, and like the expert that she was able to notice the scars and marks on Emma's wrists, face, and arms. She insisted that Emma tells her what has been going on in her life. This young lady shared a story about her own domestic violence experience at the hands of her husband. It is then that Emma felt comfortable enough to open up to her about the violence she was suffering in her son's home at the hand of her in-law. She comforted Emma and encouraged her to speak up and seek help. The social worker also requested to speak with Emma's family. Rose admitted her mistake and begged Emma and the whole family for forgiveness. She promised to give Emma the respect she deserves. Today, Emma is happy, and she wants every senior to know their rights. She is glad she was finally able to break her silence. Break the silence in COVID-19. Join us on a journey of series of 10 workshops live on Facebook and YouTube during October and November 2020. Organized by Artisans Development and Network. Funded by Canadian Red Cross. For more information, artisanartisans.org/events. info@artisanartisans.ca.
Good afternoon, everybody, and welcome to the fourth workshop for the Break the Silence in COVID-19 series. This series is presented to you by the Artists and Artisans Development Network, and it is being funded by the Red Cross Canada and in support with Geisha Productions Incorporated. I'm very happy and honored to be a part of this event. For those of you who are just with us for the first time, if you want more information about us and what we do at Artists and Artists Development Network, please follow us on Instagram. All of the links and all the information will be below. So like you just saw, these workshops have been running all the way through October, and we will be continuing them all the way through till the end of November. So I'm very excited actually to be a part of this one because we have expert and we have the artist of the day, and they're going to our speaker for today, Mrs. Rayanne Rideout. She's going to be speaking to us about the preventative measurements of elderly abuse. And she has been an expert in her field with over 16 years of experience. So I'm very happy and honored to be hosting this event with the Artists and Artisans Development Network. Our talent of the day is Mrs. Queen Lemoy, and she's a spoken word artist and also a published poet and an incredible, talented Canadian artist. So I'm very excited to be a part of this showcase. So for those of you who guys don't know, the Artists and Artisans Development Network was founded in 2014. And basically they were founded to provide resources and community development to artists and artisans of new immigrants and people of visible minorities. So that's really incredible. Just within that span of time, they've grown exponentially. They've grown to accommodate over 500 artists, and they have over 112 languages helping across cultural economic opportunities. So that's really incredible. Their mission is to provide support and opportunities for economic and social development to artists and artisans and all artistic practices who are newcomers to Canada or from a visible minority. This Break the Silence in COVID-19 series was basically put on to be a part of the community, to be the heart of the community. Not only do they provide resources and economic community development, but everybody needs support in other aspects of their life. And today our expert is going to be speaking about elderly abuse and domestic violence against women, specifically within the COVID-19 period right now, because statistically, there has been a rise in those cases during this time. And you particularly might not be directly affected by what is going on right now, or by one of these topics, but you might know somebody that is affected by it. So even if you're not affected by these or not directly affected by any of these topics, it's good to stay with us because there's going to be a lot of great information being showcased within this workshop. Like I said, our expert, Rayanne Rideout, has been an expert in this field of preventative measures in terms of elderly abuse for over 16 years. So she has a lot of experience, and we're going to be talking with her, and she's going to be telling us all the resources and all the information that we're going to need or just to pass on to anybody. So I'm really, really excited and honored to be hosting this event. Okay, so to break into our workshop and to start us off, we're actually going to hear from Queen Lemoy, who, like I said, she is an award-winning spoken word artist. She's a published poet, and she's also an arts educator. She was actually recognized for one of 100 Black women to watch in Canada for 2015, winning the 2016 Brampton Citizens Award for Arts Acclaim and nominated as the top spoken word artist for the Caribbean Music Entertainment Awards in 2017. That's pretty amazing. Her artistry, excellence, is determined to use her language, her culture, and her soul for healing and uplifting and to glow up all of those around her, creating new paradigms while defining her own normal, and in the process, encouraging others to do the same. So without further ado, I introduce Queen Lemoy.
I used to be ashamed of the loud reverberations of my voice as it filled the room. I guess that's what happens when what you use to state your truth in the world is equated with whether or not people will choose you. Don't laugh too loud, exuberant joy. Don't shrill too bold statements of self-affirmation. Don't rain down like volcanic lava or warm summer rain or cleansing shower streams, words of poetic revelation. Don't let your words of poetic revelation be too stiff or too withholding or too marvelous even. Be smooth sometimes and be quiet always. Don't say things like, I love you, or I need you, or I see you, or you are too less for me, or I know that you can be more for you. Don't say those things too much. For to give of yourself in outside terms is seen as a sign of weakness, and there are those among us who still haven't learned that our weakness is also for our strengthening. I take up space in a world that sees wide open mouths as threatening. Don't let your mouth be too round when you say no. Don't grin too hard or too fast when you say yes. For respectable folk don't like a wild woman who fills rooms with her voice without their consent. If you speak without their consent, they will never choose you. Bless. That is such a relief to this voice that is tired of wallflowering in corners too dust-free to have been placed there by accident. Please tell them that I have already chosen myself.
Thank you, Queen Lemoy. That was an absolutely beautiful, beautiful performance. And we are very grateful for her to be a part of this series. She's made it very possible to be a part of this series, even though with all the virtual things now with COVID-19, everybody's online. So thank you so much, Queen Lemoy. I actually forgot to introduce myself. So my name is Afoma Amechi, and I will be your host this evening. And I just want to give a special thank you again to the Canadian Red Cross, the Government of Canada, and our members of Parliament who have made this event, who contributed to help us make this event possible. Our Member of Parliament, Salim Zahid, and our Provincial Member of Parliament, Christina Mateus. So thank you guys so much for that. And again, thank you, Queen Lemoy, for that very beautiful performance. So I just wanted to know how many of you guys know this, but did you know that over 35% of crimes committed against the elderly are actually from family members? I know, it's shocking. That's an extremely high number. For those of you who don't know, that's extremely high number. You would think that it's within the family. This is people that you're supposed to trust, that are supposed to be there for you, that are supposed to take care of you, regardless of your age. We trust them with our little kids and with our older parents, with our older relatives. So 35% of crimes committed against the elderly are done by a family member, and that is really, really something that we're looking at this workshop to discuss and give people the resources and information needed so that maybe if they are struggling with something and they don't know who to talk to, or they're stressed and they're handling something like we saw in the opening video with the lady that was looking after the elderly woman, sorry, and maybe there's something going on with herself, and she's pushing that onto an elderly person that she may have to be looking after or taking care of. So this workshop is, we're focusing primarily on elderly abuse and the preventative measurements that we and everybody, not only, even if you're not directly connected to it, but everybody needs to be cautious and be aware of, what's going on, even if they happen to see something or just at all. So I'm really excited to learn more. And if you guys want to find more information through the government, you can actually go to www.seniors.gc.ca or call a 1-800 number, 1-800-622-6232. And you can find some stuff online about elderly abuse preventative measurements or things about seniors in general. So that is amazing that they have that online for you guys. So without further ado, I want to introduce our speaker of the day, Mrs. Rayanne Rideouts. She has over 16 years of actively engaged community stakeholders and service providers as the Central East Regional Consultant. Rayanne is currently engaged in building collaborative partnerships, whether locally or nationally. She provides a forum to apply over 23 years of experience working in the field of elderly abuse. She is the EAPO is mandated to implement the Ontario strategy to combat elderly abuse. And as such, forging effective sustainable partnerships is key to the success of strategy. She has comprehensive training skills, presenting to frontline service providers across all sectors, delivering public education sessions for older adults, and facilitating collaborative initiatives between community organizations to effectively build capacity for response and interventions where older adults are at risk of experiencing abuse. Rayanne has been an instructor for the Foundation of Elder and Prevention course at Trent University for the past 3 years and has co-authored, published various research articles on the complexities of elderly abuse. For over 8 years, Rayanne served as co-chair of the Canadian Network for the Prevention of Elder Abuse and director of that board. So without further ado, I would love to introduce Mrs. Rayanne Rideout.
Thank you, Foma. Thank you for that welcome opening remarks, and for the video. Everything is it's going to be an interesting talk, I think, today. So thank you for sharing that.
Yeah, thank you so much, Rayanne. We are honored to have you. You have so much experience in the field of elderly preventative in general. So we're very excited to listen to everything that you have to say and learn from you. And for those of you who want to ask Rayanne some questions, feel free to drop those questions in the comments, and we will try to get those answers for you. So whenever you're ready, Rayanne, take it away. Go ahead.
Great, thank you. I appreciate the opportunity to speak with everyone today. It is such an important topic that we're talking about, and as Ifoma indicated, this time of COVID has really escalated the situations where seniors are more vulnerable and at risk of abuse. It's often referred to as the hidden crime. And now so more than ever with that social isolation component added to the social distancing and trying to keep everyone safe and healthy. So some of these situations of abuse may not come to the attention of everyone as it may have in the past, only because we're kind of more behind closed doors than we have been previously. Now, not to say that abuse hasn't happened, we know it has. But I think this is so timely because we've been doing a lot of education and outreach in the community through virtual learning and webinars, et cetera, through our organization. So we appreciate the opportunity to reach a wider audience through programs that are offered today. I think this is a great a network that is offering such a diverse number of programs and issues related to the issue of elder abuse. And today I really want to focus on the issues around seniors' rights and really kind of reflect on the issues around ageism. As Ifoma indicated, everyone can take a role in responding to abuse. It doesn't have to be just if you only have a certain family member living within your home. We're all connected and interconnected as a society to take responsibility to look after our older adults in society. So when I talk today, I hope that you'll take the message beyond just in your own family, take it beyond your friends, your network of networks. We all have a role to play in the prevention of elder abuse. And if I can leave with any message, that would be it today. Whatever that role can be, we can all take different actions at different times. One small action can make a huge difference in someone's life. even starting or having that conversation with someone that maybe never been approached before can start a prevention or a limit or decrease risk, reach out for support to that individual. So I'm just going to put my I have a PowerPoint presentation that I'm going to present around seniors' rights and reflecting around ageism, because when we talk about this issue, ageism really is one of the underlying factors around abuse. And as I go through the presentation, this will really resonate with our views about older adults and how we value them in society. And are we, neglectful individually, with our own perceptions and values, as a institutional kind of concept of policies and procedures and programs and systemic issues that are happening, but also as a society, our own values and beliefs and actions that we put towards that, are they contributing to the abuse of older adults? So hopefully you'll get to learn a little bit more about that. So I'm going to share my screen and we'll get on with the presentation. So I want to talk, as I indicated, about promoting seniors' rights and treating people with respect, because that really is the bottom line. This is what it's about. No matter what age you are, what you concern as what old is. We're going to talk a little bit about what ageism is. How do we define that? And how does it relate to elder abuse? Like, what's that association? And why am I really focusing on that? We'll go through those kind of points. We'll talk about what the human rights issues are, because that's really relevant and really really ties in with the issues around ageism. And as Ifoma said, it's really important to talk about what resources are available to support older adults in this time of need and of isolation. Programs have been cut back in terms of being able to go out to do one-to-one support. So where can we reach out for help when we need it? So I know there's a little bit of background about our organization, but I just wanted to give you some highlights about our group, which is the Elder Abuse Prevention Ontario. Our mission is to make sure seniors are free from abuse and are safe and the bottom line, respected. And you'll see our tagline about restoring respect. We use that on a regular basis within all of our social media, because that's really what it's about. And I think the video around Emma that was just talked about before, the last words that were in that video was about respect, that she understood what she was doing was wrong and that she had to respect the older adult and her mother-in-law within her family. And that's what we have to reinstate within our society. And we all, like I say, have a role to play within that. So our organization is funded through the Ontario government, through the Ministry for Seniors and Accessibility. Back in 2002, we were given the responsibility to implement Ontario's strategy to combat elder abuse. And within that, we have three main priorities, although there are a lot of activities that go under with each of these components, but we really play a role in coordinating community services and a response. So we work with our community partners, our agencies, local, national, provincial, to work together to respond much better to elder abuse in a coordinated fashion, because we know the complexities of elder abuse don't rely on just one resource. We have to work together as multiple organizations to assist families and seniors to get the help that they need. We also do training and education to all frontline providers that are interested in getting our assistance and training. That includes personal support workers and hospital sectors and EMS and firefighters, dental hygienists. It goes on and on, the amount of training that's expanding over the years that we've been providing. And then public education awareness. So being able to provide sessions like today on social media is an excellent opportunity for us to get the word out for individuals, particularly for those who may not have had the opportunity to learn about this before. So I want to start by saying elder abuse is not a new issue. This has been around for years. I've been in the field for quite some time, but this was happening way before I got involved. And what we find now is that, unfortunately, with COVID, it's really brought the issue to the forefront. We're seeing the issue being talked about in the media. We're seeing it on television and radio. We're talking about it in society. Families are talking more about it. But it's unfortunate that we have to talk about the emotional heartache, the physical pain and financial losses that people are experiencing because of someone they trusted. Ifoma talked about who those primary perpetrators are: family, the last person you would think that would cause harm to you, and those are the individuals that are causing the pain and suffering to those older adults primarily. Now, not to say other people aren't involved, but those are the primary individuals. And I would encourage you, I'm just going to leave this up for a second. If you go on to Help Age International, they have some really good resources and videos around the issues around ageism, COVID. We don't have time within our session today to show all the videos that they have, but there's some really good videos. They're very short, but talk around the intersection around elder abuse and the respect that we need for older adults. And with COVID, what we found is that these vulnerabilities are really coming to the forefront. I mean, you think about the global pandemic and how it's affected other countries and for older adults, that some are being left behind. They're not being they're not seen as a priority in the healthcare system. They're saying that they have no medications. There's so many multiple factors that are happening that it's really important that's why we need to do this education. So with COVID, we've seen more of those vulnerabilities, or these vulnerabilities have put people that are older at increased risk of abuse. And some of those vulnerabilities have to do with social isolation. And I think we can all relate to the isolation piece of it in terms of what we've had to do with social restrictions, to keep us all safe. But for an older adult who may not have very often a visitor, let's say from a family, or lives in a rural area, or even in the city, who can't get out to get groceries like they used to, or are dependent on someone to provide those groceries or medical appointments, they're more vulnerable. They may not be getting the attention or the healthcare or the basic necessities that they've relied on now. Maybe if there's that dependency on the older adults dependent on someone to bring them groceries, and they say, well, I'm too busy, I don't want to spread there's some legitimate feelings that they don't want to pass on COVID, which is more, we totally appreciate that. But maybe the person can arrange to have home delivery of groceries, or picking it up by the car. There are other ways that we can reach out to individuals, but we do find that social isolation is a huge risk factor. And we find that with isolation, it just starts small, but as it isolates, as a person becomes more isolated, the abuse can escalate and get out of control. We've also know that older women, and we were talking about domestic violence, and we know that older women are more at risk of domestic violence than men. However, men do experience domestic violence as well. But we primarily know from even younger ages that women are more vulnerable to abuse. We also have vulnerability within the LGBTQ2S community. We've been doing webinars recently to address those issues and bring that to the forefront for people to be much more aware, and how we can prevent that from happening. Also, people with low income, they may not have the financial resources or means to maybe get the assistance that they need or services. So that could put them at risk of not being able to reach out or pay for services to get some support that they need. And some vulnerability is also someone who's experienced abuse in their past. So that could be maybe as a child or middle-aged, anything that puts that person that may bring the issues of trauma may carry on later in their life as well. So one of the other factors is vulnerability due to cognitive status or dementia. The person may not be able to reach out for help because they don't have the understanding of how to do so, or don't even recognize what's happening to them is abuse. So, not being able to tell someone what someone's yelling or screaming at them, or stealing their financial, their bank account or all their funds, because they don't have the insight or understanding because of the cognitive status of that individual. And those situations are extremely vulnerable, because unless someone else is sort of paying attention or checking in with the family, it could go unnoticed. And now with COVID, that vulnerability could be increasing if we don't keep those connections. And also physical health. So people who may have issues of not being able to get out, may some mobility, winter's coming, again, it relates back to the isolation piece. So we have to pay attention to some of these warning signs and the vulnerability. So if you have someone in your life these are just some samples of vulnerability, it's not an exclusive list, but those are the primary ones. But if we have someone in our lives, they pay attention to some of the family dynamics that are happening, because, social isolation is what we need to sort of reduce, but in a safe manner. Because social isolation, to keep ourselves safe from COVID, doesn't mean that we have to be socially or we don't have to be emotionally disconnected. And I think that's the key that we want to say. There's a lot of ways that we can keep connected with an individual, and by telephone. We're on technology now. Seniors, some people may not have access to the iPads or iPhones and that kind of thing. So is there other ways that we've seen people do window visits? There's so many different ways that we can connect, even writing letters, getting back to the old way that we used to communicate. People we need to keep that connection, to keep in touch with individuals. This is just a campaign that we did for June for World Elder Abuse Awareness Day, when we focused around isolation and how we need to uproot elder abuse around that ageism. So I'm just going to ask you yourselves, when we think about seniors and aging, what does old look like to you? When does old age start? 50s, 65, 80? Maybe it just depends. We all have a different kind of point about what's old. If you ask a younger person what they think is old, they may say, 45 or 50, where if you ask someone who's in their later years, let's say 70 or 80, they may say, 90. It's your individual perception. There's no sort of like, this is what you have to be in terms of what old age, but we make assumptions about old age, right? We make these, and usually they're negative, but we try to separate people into different groups. Like old age starts when you're 55, or it starts when you're 65 or 85, or maybe it's 100, right? I have relatives that are older and they wouldn't consider themselves in the older group, even though they're very active and outgoing. We do have age groups that start for, discounts in stores or government benefits. Those are for, specific programs. But, as a society, when does it start, right? It's all up to us. And I think what happens is we fall into this ageism idea when we think about seniors, and that we think, well, if they're 65, they're old now. And what does that old mean? We don't, like I say before, it's not very positive. So in 1969, Robert Butler coined the term ageism. And it's not something we hear every day, but there's been a lot more campaigns, I can tell you, during COVID, to really make this a more prominent campaign that we talk about older adults, because it is discriminating against older people primarily because of age, with this distinct valuing of younger age groups. So it's that older adults aren't as valued as much as younger age groups. Now, ageism does cover discrimination against younger people as well as older people, but we find it's mostly older adults that are experiencing this ageism discrimination the way that Dr. Butler had described it. So when you think about yourselves, think about your own attitudes and behaviors towards older adults. And it's important that we start thinking about that as we go through. But also think about our population. How many older adults do we have in Canada? In 2015, the Canadian stats, we have more seniors than we did the younger generation under 15. So that's remarkable when you start thinking about where's the shift in our society about the population in terms of where we need to be shifting our attitudes, our services, our programs. We have a smaller, younger age group that's going to be looking after our aging population. So there's going to be a real gap. And if we don't start changing the way that we look towards adults, how are then we ourselves, when we get older on that curve starts going up, how are we going to be treated if we don't start changing the discrimination of older adults? So have you yourself ever been treated differently because of your age? Just thinking about that. Yes, no. I've had many conversations with older adults and asked them, like, how did that make you feel? Was it a positive experience? Did you say something? Did you just sort of let it go? Everyone will take those differently. Some of the things that we hear about those ageism kind of tones are like older adults are slow, maybe boring. They think they know everything, cranky. They're a burden to the healthcare system. That we see often. Are forgetful. They're not competent. Big one, treated like a child, right? That paternalistic idea that you can't do that anymore because you're an older person. well, there may be reasons because a person's maybe health or they're not capable of physically doing something or mentally, but don't have to treat the person like a child, right? That we use words like honey and dearie. And sometimes people will relate really well to that, but there are others who don't want to be treated, don't want to be called like that. So I think that's important to identify. And that, again, that incompetency, that people don't think the person, because they're older, aren't going to be able to understand. They won't be able to tell anybody if I'm yelling or screaming at them or treating them badly. They don't know where to go anyway. Like, well, they're too old to make a difference or change anything. So they're just going to just deal with it the way it is. And, those are unfortunate because that's not the way it is. But we have these behaviors that we are portraying on a regular basis. And um, we have to change the story about aging. We have to choose how we want to live and age. Each one of us, we're all aging. If we're thinking about ageism, we're all aging each hour, each minute, each second. Are we just being ageist towards ourselves because we're all aging, right? So just thinking about that is, put that into perspective about, if we don't change thing now, is it going to change later? And we have to look at how we're going to help those people that are in Ontario, across our globe. There was a survey actually done by Rivera, and they asked seniors across Canada if they felt that they've been treated unfairly because of their age. So this is just a question. What would you think? How many seniors would think that they're being mistreated, right? So that mistreatment in terms of not being treated unfairly, right? Not equality. What happened was that 63% of seniors said that they were treated unfairly because of their age. 63, that's significantly high. And half of them said that they felt that, Canadians say that ageism is the most tolerated form of social prejudice that we have. Over half of those respondents. That's significant. When we think about the other ageisms that are out there, ageism is like right there near the top. So I just put this infographic up there, and they have a great report. But I just wanted to, it's really important that we pay attention to the stereotypes that we have as a society. 1 in 3 people treat someone different because of their age. That's, it's alarming. And how does this relate? Because when we don't treat seniors with respect and we discriminate against them, that just gives us that feeling or belief that it's okay to mistreat older adults, that belief that they're not as important. It supports that it's okay to, not put them older adults out as a priority. And we sometimes see that as where elder abuse starts to stem from. So we have to change that. Is there a human rights code to protect older adults from discrimination? You may or may not know, but in fact, there is. We think about as a human right. Does that really fall under the human rights code? Someone being treated because of their age, age discrimination. Let's say in policies, you can't enter this program, or you can't go to this facility if you have or have nots. Those kind of things. And there has been some marketing spoofs and some campaigns that have been done in the States just to let people, like younger people, recognize how ageism kind of works. They were like standing outside like a stand, and they were giving away prizes, and they were saying, well, if you're not, if you're not 60, then you can't sign up. And the younger people were so offended because usually it's the other way around, right? And that they wanted this free gift, but because there was an age criteria, they were left out. So it got people to sort of do that reverse thinking around ageism. But there is a human rights declaration in terms of the United Nations. So all the countries kind of have started that movement back in 1948, where we try to make our communities more age inclusive. So we have a human rights declaration. And in Ontario, we've actually moved towards having age-friendly communities across Ontario and making our communities more inclusive and equitable for seniors. Under the Human Rights Code in Ontario, we do have disability as a human right in the Human Rights Code, and age is included within that, along with all these other ones listed here on the slide. So back in 2001, the Ontario Human Rights Commission actually did a campaign to try to bring awareness to society around ageism. So they had this poster campaign that they put out, and they had expiry dates, as you see on these two posters, a best before date, really trying to get to the point that, you know what, just because you reach a certain age doesn't mean that you expire, that you're not of need anymore. And it was to get people to stop the discrimination, that, you know, there is still value. There's no shelf life on someone's life, that we need to identify abuse and respect as a human rights issue and to get people more aware of it. And if you look at what we've done in terms of human rights over the years, looking at, you know, difference of different sectors, you know, the rights of women, started in the white women are persons, 1929. You know, you think back that's not that long ago. Look of our racial equality, the rights of people with disabilities, the rights of LGBT individuals, being able to get married. I mean, that's not very long that we've had those rights in place. Recently, we've also had the medical assistance in dying, that right evoked also with the, there's been a new charter for the rights of people with dementia about how they need to be treated with respect and to be included within their care plans. So as you can see, there's many different ways that human rights really ties into the issue around elder abuse. And if someone does have a problem or feels that they're not being respected in terms of their human rights, there is a human rights tribunal that individuals can go to if they feel that they're being treated unfairly. So in Toronto, there is the office, and you can have a hearing and mediation available for individuals. We also have the Canadian Charter of Rights and Freedoms. So we all have the right to live at liberty and security of the person. Again, I want to bring to light, these are important because sometimes people don't realize that they have rights, and that doesn't matter where you are in the community, what cultural background, what community. Everyone has the same rights wherever you live within Ontario. There is a movement within the convention, the UN convention, to have the rights of older persons, to move that in terms of having a specific declaration on human rights for older adults. Now, that's taken a while to get moving and adopted, but we are getting to, that's getting onto people's attention and the agenda at the global UN level. And we hope that that will change very soon. So what can we do about ageism? How can we change that for ourselves? We need to start with ourselves. We need to look at our own thoughts and own values. Where do we put seniors? Call it out. If we see somebody doing something that's not right, they're calling us names, they're not being patient with us, we need to stand up and say, you know what, I am capable of doing that. Just give me a little bit more time. I understand, speak a little bit slower. I know I have a tendency of speaking fast, and I try to get as much information as we can, but it's important to pay attention to some of those ideas, and that we're resist that temptation of putting ourselves down because of our age, right? Or tease others because of their age. We need to start to change those habits and behaviors that we kind of get into. And again, just planning ahead and talking about this. What I want to do is, before I end, is just talk about some of the ways that we can prevent this, also, and talks about just some services. So we've seen a lot to keep that social connection, right? To decrease that isolation and the ageism that we have. There's programs like Seniors Without Walls, and many senior programs are offering that, where you can telephone in or do by Zoom or video calls, where you can connect with other seniors. Remember, try to, if you have that iPhone, to have a meeting with the healthcare provider if you can't do in person. There's a lot of phone supports I'm going to talk about, and there's a lot of web access. There's many programs available online, including some of the resources that we've produced, that you can get some of these tools on our website, which is Elder Abuse EA Prevention Ontario. You can find out more of our information. We have a senior safety line, so you can go, there's a phone number there that you can call. We've seen an increase of calls 10 times since COVID started. So the calls that go to the Assaulted Women's Helpline, they actually run that line, And we also have the overflow of calls that come to our office. For women who are in situations of domestic violence, they can call the Assaulted Women's Helpline. So they can call the 416-863-0511, or they can call the toll-free number, which is the same with 866 number. They can get assistance on the phone, crisis support. But there's also an elder appeal. I took some of the phone numbers within Toronto. The Peel Elder Abuse Support Line, which is 905-459-7777. And again, they have services in Punjabi, Hindu, Urdu, Spanish, Portuguese. They have multiple languages that they provide support in. And I did forget to say that the Senior Safety Line actually provides services in over 150 languages. So you can get that support in multiple languages as well. There's also the Toronto helpline that seniors can get. They have a crisis outreach program for seniors as well. So that is available. And if you go online, Google Toronto Seniors Helpline, and you can get the information and services that they provide. These are just bits of what they provide. Just to highlight some of the legal support services is the Advocacy Center for the Elderly. They're a great resource. You might have seen them on the media recently. The Family Services in Toronto, they do have a program available in the Scarborough area where we can provide counseling, and they do have a shelter called Pat's Place for older adults who are abused if they need to get away for a safe place. The Family Councils of Ontario, if you're concerned about a loved one in a long-term care home, they're not a hotline, but they can call and just talk to you about, they have a lot of support programs for families within care homes. And these are just other programs within the community. I'm not going to list them all. You can see them here on the screen that also have programs that relate to senior programs to keep people connected. And some have elder abuse specific counseling and resources. So before I wrap up, there is the police services. So if you're in the emergency, call 911. Or in Toronto, there is a vulnerable persons coordinator that deals with elder abuse issues. And lastly, reporting around long-term care and retirement homes. There's mandatory reporting within both of those sectors. So you can call the Long-Term Care Action Line or the Retirement Home Regulatory Authority if someone lives in a retirement home. They have investigators, and it's mandatory for any staff, individual visiting, if they suspect abuse, to report that. So thank you. Keep in touch with us. We have our hashtag here in terms of our social media that you can keep connected with us. There's my phone number and our website. So thank you very much for your time.
Thank you, Rayanne. That was just absolutely exceptional. You've just given us so much knowledge, so much information, and you've pretty much answered every single question that I think anybody could possibly have. Even all the questions that I had, you've answered them. So thank you so much, Rayanne. Rayanne will be sticking around quickly if anybody wants to have any other very pertinent questions that they had after our second performance by Queen Lemoy. And just a reminder, Rayanne is the Director Partnerships and Outreach and Regional Consultant at the Elder Abuse Prevention Ontario. So she has a plethora of knowledge and resources, and she is the go-to woman in this case. If you're dealing with elderly abuse, if you're dealing with how to prevent these measures, what to do, how to stay active, how to stay well, reach out to them. Reach out to Rayanne at EA Prevention ON on Instagram, and make sure to follow them. And also, if you want to continue, if you haven't already, make sure that you're following the Artisans Network Development on Instagram. Like I said, this is the fourth workshop to our 10-part series, and we have workshops going all the way through to November. So you can see just how informative and packed these workshops are, and they're put on for you guys to give you guys the information, the resources from all aspects of your life, especially now during COVID-19, where things are crazy and you might not know what to do. So we really want to keep you guys informed and ready. So let me just quickly wrap that up. So thank you again, Rayanne. That was an excellent presentation. And we are going to jump right into another performance by our artist of the day, Queen Lemoy. Take it away.
You're here now. In that place you told yourself you would never reside, that fear place, that destruction place, that giving up place, that hand hitting hard against skin place. Your skin is rougher now. You've adapted to that place. That words smacking across triggers place, the tears in the bathroom place, eyes once bright, now hiding behind dark glasses place. How many times are you going to fall or bump into the furniture, sis? You're here in that not safe to be wife, woman, mother, lover place. That place you always tried to protect yourself from when you were more you. Now you call that place home. House feels so cold and removed and detached from the love you still hold on to in your heart, but home. Home feels like the hope that one day it will be picket fence and sunshine and singing birds outside of honest windows, warm, tender, and loving. But now, in that place, the word love has become synonymous with hate and pain, and you hate yourself for loving them, for wanting to make them love you. The ideal place of picket fence and sunshine and singing birds outside of honest windows, that place doesn't exist where you are now. So what now? Now is the fight. Now is you fighting your way back to yourself. You've forgotten her. In the midst of the pain and the hurts and the disbelief, you've forgotten the fire that once burned in your belly. Fight your way back to the warmth of your flame. Fight so hard that your sweat tastes like being set free. Fight so hard that the soles of your feet burn and they feel like being set free. Fight so hard that your lungs stretch like being set free. Fight so hard that you remember it's not your fault. You are not to be blamed for that place. You are fighting. And you've made your way here now in that fighting place. And you can see it. You can see that you are being set free. Your fight is not in vain. It hurts. It makes you feel anxious. It's outside of your comfort zone. That place, as hard as it was a comfort zone. But you can see it. You can see the universe stretching itself just for you to break the silence and be free.
Thank you so much, Queen Lemoy. That was just an absolutely beautiful performance, and it relates so much to what we're talking about today, which is the prevention of elderly abuse and domestic violence against women during COVID-19. Thank you guys so much for everybody that has been in this session, in this workshop. Thank you guys so much for being a part of this. We are doing this for you guys to have this information. And it's been such a pleasure to be a part of the Artists and Artisans Development Network and to be tapped to host this workshop. So thank you guys so much. Again, I just want to reiterate, we just heard from Rayanne Rideout, who is an expert in her field of elder abuse prevention in Ontario. And the number for elder abuse prevention, if you want to get more, if you want to know more information, is 1-866-299-1011. So again, it's 1-866-299-1011. Get in contact with them, and they will be able to assist you guys. So we're also I also actually just wanted to say that, elderly abuse and elders and our older citizens in our society are like, I heard somebody say something really amazing, which is they're like libraries because, older people are so much filled with wisdom and experience and things that us young people can really learn from. So, be really patient with older people because we're all going to get old one day. So, it's up to us to take care of our old and just like we want our young one day to take care of us. So, exercise some patience, be considerate, and be compassionate. And that's exactly what we're asking everybody to do today. So I just wanted to take this time to acknowledge some of the supporting team who've made this possible, who put on this amazing workshop for you guys. Don't forget to follow on Instagram, the Artists and Artisans Development Network, for more information about the upcoming sessions that are going to be going all the way to November. Our board of directors of Artists and Artisans Development Network, Geisha Productions Incorporated, partner agencies, Positive Community Development, Creative Joys, Chocolate Films, IDRF, Ryerson University, Trios College, the University of Toronto, the Diversity and Cultural Association, and Sarah Gujan Music Academy, and all the other people that have supported us and have helped us to put on this show. We appreciate and thank you guys so very much. So now we're going to get into a very, very quick Q&A with Rayanne. We're going to bring her back. I know she did such an amazing session, and she pretty much answered all of our questions. But just to bring her back, hi Rayanne, how are you?
Hi,
Thank you
I'm
so
good,
much.
thank you.
Your session was incredible. I think you really made it possible for everybody, regardless of who we are, or if we have a direct connection to a older person, to just be aware of the signs and the things that we can do to make sure everybody's having a great time during this COVID-19 period, because it is hard on everybody, especially the seniors, right? They're getting hit the worst. So we really want to be patient with them. So I would just want to say, Rayanne, if somebody's in like a very desperate situation right now, what would you recommend to them? Would you what would be their outlet?
So I guess in terms of desperation, I do sort of want some clarification, because if we always say if there's any emergency, safety, obviously call the police, because if that's the urgency, or EMS, whatever, if that, depending on what that urgency is.
Okay.
But I think it's important to recognize where there are resources that people, as I mentioned some of them today. But the biggest thing is reach out to someone you trust, that you feel comfortable having a conversation with. That could be a friend, it could be a neighbor, that you can just have that open conversation to say, what, things aren't really good right now. Can you be there to support me? Or having a conversation to someone can just support them and maybe get them connected, because they may not have the resources, they may not have the knowledge about what services are available. So they might be able to look that information up and get back to them. And if they don't have transportation, take them to somewhere that they can get that support for them. I think that's really important. Having that conversation can be probably the most difficult part of helping someone, because people don't know what to say. It's one of those topics where it's in any form of abuse, but particularly for seniors, it's like, how do I bring it up? Do I walk away? Do I include the older person? Like, I don't know what to say because I don't want to cause them more problems. Is it, people feel it's not their business, right? Because it's their neighbor and they heard the screaming, they hear the yelling, maybe in this cartoon that you showed around Emma, maybe people know that the daughter-in-law is not acting nice, but they don't know, what do I say? Do I talk to Emma? Do I talk to her and have that conversation? But it's important for all of us to speak up, because we all have a role. All we have to do is even start the conversation saying, is everything okay?
Yes.
And they let them start that. And they may say no. And then you can say, okay, well, how can I help? And let them tell you what they would like to see as help, because with abuse, often it's that power and control that's taken away from the person, that someone's already making those decisions. So it's
Mm-hmm.
important to include them in the response and say, don't run off and, do X, Y, and Z without sort of consulting with them, because maybe they don't want to do that in the first place. So that's not going to be very helpful. So just say, can I
Exactly.
sit down with you, or do you want me to call somebody that we can connect you with? And most often people will say yes.
Mm-hmm.
And they're just waiting for someone to reach out and ask them that question, right? And what we do is we say for bystanders or for other family members is you don't have to solve the problem. It's starting the conversation, which will then take some time. Nothing happens really, really quick unless it's an emergency. Sometimes it takes a long time for people to get the assistance and help that they need. But we're always there and to support and give people the resources that they need. That's the role that we play as well.
Yeah, and that's really excellent, because that's it's sometimes so hard for somebody to ask for help, and especially seniors. They're always so considerate about not stepping on, the younger family members' toes, and just wanting to be like, just be there and not
Yeah.
not be like they're a burden to anybody.
But there's also
So
there's also a reason behind sometimes where people don't ask for help, because like anybody, like all of us, when we ask for help, what does that portray? It feels like we're not
weakness.
capable of doing.
Yeah,
Exactly. And as we get to the ageism piece, is that weakness thing is like, I don't want people to think I'm not capable of doing it anymore. Why are they going to treat me even
true.
worse if I say I can't do it? Right. So there should be no
Hmm.
shame for asking for help at any age, right? It's
I love that.
okay, right? It's okay to
Yeah.
ask for help. It's okay to say that you can't do something. And we need to get away from that it's bad to ask for help. Like that's again, it's a societal thing that at all ages that it's okay, especially right now, when we're all in need for help and assistance mentally, socially, that there's no stigma that should be attached to that, no matter what the person's age, but even more so for an older person. And we shouldn't discriminate against someone because they're not capable or not able to do a certain task or behavior or action that they need some help with.
Yeah, I love that. Thank you so much, Rayanne. Rayanne, if people want to get in contact with you personally, can you just give us your contact information? How can they reach you? How can they reach the Elder Abuse Prevention Ontario?
Yeah, so the easiest way, I think, is just to go to our website, which has all our contact information, which is eapon.ca. We have our main office number, which is 416-916-6728. And our administration person will answer the phone, and if they need some assistance, and we'll refer back to myself or another regional consultant within the area to provide some assistance and information to that individual.
Okay, perfect. And then we also have the 1-866-863-0511 number. Is that the seniors helpline?
I'm not sure which one that is. The senior safety line that we support
Senior
with
safety
yourself.
line. Yeah.
Yeah, sorry. The senior safety line is 1-866-299-1011.
Okay,
They can help
perfect.
seniors in the information referral. They give them connections. They're trained counselors, so they can provide that counseling and support online to individuals
Awesome.
as well. And it's
I love
live. You
that.
don't get they don't get a recording kind of thing. So it may be
Okay.
busy. So we ask people to have patience because there's that one line, but call back because if they can't get support, they can also again go to our website and they can call our organization as well.
I love that. Thank you so much, Rayanne. It's been an honor listening to you. You've just been filling us with so much information. Thank you so much being a part of this. You're really just making people aware, giving us so much education, and we appreciate you for being a part of this session with us at Artisan and Artisan Development. So thank you so much, Rayanne.
Well, thank you for inviting me, and I appreciate the support from yourself and the whole team that brought this together.
Thank you.
Thanks.
Thank you guys so much. So that was Rayanne Rideout. She's the Director of Partnerships and Outreach and Regional Consultant for Elderly Abuse Prevention on Ontario. That session was extremely informative. She just gave us such great information about elderly abuse preventative measurements and what we can do as young people to assist older people during this COVID-19 period, and also maybe an elderly person experiencing domestic violence. because both of those things have risen during this time. So thank you again to Rayanne. Thank you again to our artist of the day, Queen Lemoy, who has just given us some very beautiful spoken word pieces that were just so that connected beautifully with the topic today. And thank you guys so much for continuing on in this session. I hope you guys enjoyed it, and we'll be returning back for another session next week, Saturday at 2 p.m. again. So I just want to do a special thanks to our team for putting this together. Our team of Shirine Mandani, Gloria Gif Nkunde, Manal Hussan, Brian Kazala, Blessy Regulus, and Mara Carmen Taylor. Thank you guys so much. That is the team behind this amazing session. And I just want to thank them as well for giving me the opportunity to host, because I've learned so much as well too, being that I have elderly people in my family as well too. So just little things that I can do right now as well to make their life a lot more pleasant. And then once again, I want us to thank the Red Cross Canada, and of course, Artists and Artisans Development Network, Geisha Productions for the PR and artist management. And don't forget, you guys, like I just said, we have workshops going all the way through November. Follow us on Instagram at the network, at the Artists and Artisans Development Network Instagram, to follow up on what's coming up next Saturday. And then if you guys have any additional questions, feel free to email info@artistandartisans.ca. That's info@artistandartisans.ca. So we are going to end off the session with another amazing performance by Queen Lemoy. So take it away, Queen Lemoy. And just a reminder, you guys, next week, Saturday, 2 p.m., we have workshop number 5. Thank you. I'm signing off. My name is Ifoma Amechi, and it's been an absolute pleasure hosting.
Queen, how dare you continue to rise? How dare you continue to shine through the cracks? How dare your light be so damn bright, guiding others to their own light? You are a sort of lighthouse. That's why broken and lost people seek your shelter and warmth, and I get why you can't let go so easily, Queen. Why you love past many expiration dates, while you refuse to dig graves, but instead spend your time building monuments, Queen. Look at you replenishing your depleted resources, plundered and pillaged, raped and underestimated. You continue to grow back. You are so green and lush and expansive. You are no third world, Queen. Oil and gold reside under your fingertips. You make coal into diamonds. You are so full of life, radiant in all of your bounce back glory, Queen. You are lit. You are so powerful. Look at you being so damn possible, like hella possible. Like the idea of you still confounds small minds, because small minds cannot comprehend big things, and you are a big thing. Continuing to stand for those who often refuse to stand for you, yet you do. And you do, and you do, and you do. And when you are tired, you still do. And when you ache, you still do. And when you have nothing else to give, you still do. And when your heart breaks, though still beating, you still stand. You still do, and you do, and you do. Queen, look at you continuing to rise. Queens, I dare you to continue to rise. I double dog dare you to continue to rise. For when the queen in you rises, the queen in me will rise too.